Hello everyone, hello students. Today's topic of discussion is phenylketonuria clinical case discussion. We are in the early clinical exposure. The topic is protein metabolism. We are in the protein metabolism. The subtopic is phenylalanine and tyrosine metabolism. Now we'll discuss an important case of inborn error of metabolism, that is phenylketonuria. The incidence is quite common and this is autosomal recessive disease. Now see the case. A 2-year-old mentally retarded child was brought to the pediatric department with chief complaints of delayed milestones, failure to thrive, hypopigmented patches on some areas of skin. Mother also noticed unusual mousy odor of child's urine. The blood and urine was sent for screening test for the diagnosis of suspected inborn error. Now there are lot of sub question. See the symptoms. 2-year-old child, mentally retarded. There is CNS involvement. Mental retardation is there. Delayed milestones. मतलब जो एज में जो एक्टिविटी बच्चे ने करनी चाहिए वो नहीं कर पाता, उसको टाइम लगता वो डेवलप होने को, दैट इज डिलेड माइलस्टोन. फेल्योर टू थ्राइव मीन्स डिफिकल्ट, मीन्स weight gain is less for that age and for that height, so less weight gain, failure to thrive means, and hypopigmented patches all over the body and mousy odor of urine. So CNS manifestations are there, skin manifestations in the form of hypopigmented patches, characteristic mousy odor of urine. Now see, what is your probable diagnosis? क्या आप सस्पेक्ट कर रहे हो पेशेंट को? Mention the enzyme defect. What is a cause for mousy odor of urine? Why hypopigmentation is seen and why CNS manifestations are there in this disease? Mention the laboratory tests for the diagnosis of above mentioned defect and what is the treatment of this disorder. So these are the sub questions. This can be a short answer question, this can be a clinical case, or this can be a clinical assay type question. So this is very important, also important for the viva, grand viva in the university examination. So incidence of phenylketonuria is quite common. It is 1 in 20,000 incidence, and inheritance is autosomal recessive. Means if parents are carrier, there is 25% chance of having the child with phenylketonuria. 50% children will be carrier, and there is 25% chance of having the child with normal genes. Now what are the symptoms and how it is connected with phenylalanine and tyrosine metabolism? All of you know that phenylalanine and tyrosine, these are aromatic amino acid. Phenylalanine is converted into tyrosine by the important enzyme, that is phenylalanine hydroxylase. As phenylalanine is the essential amino acid, tyrosine becomes non-essential because phenylalanine is converted into tyrosine. So this contain benzene ring, phenyl ring. This contain phenol ring. It is nothing but the para hydroxyphenylalanine. Tyrosine is nothing but the para hydroxyphenylalanine, and tyrosine will give you melanin in skin, hair and eyes, noradrenaline and adrenaline in the adrenal medulla, dopamine in the central nervous system, and T3 and T4 thyroid hormones in the thyroid gland. So these are the specialized products given by the tyrosine. Now what is the reaction which is catalyzed by the important enzyme, that is phenylalanine hydroxylase? Now see, in this reaction, this phenylalanine is converted into tyrosine. The another name of tyrosine here, the another name of tyrosine is para hydroxyphenylalanine. So here in the phenyl ring there is H, while in the phenol there is OH, phenolic OH group is there in the tyrosine. So it is converted into tyrosine, that is para-hydroxyphenylalanine. Para-hydroxyphenylalanine. Now see, in this reaction which is catalyzed by the important enzyme that is phenylalanine hydroxylase. Phenylalanine hydroxylase. And this enzyme is deficient in the phenylketonuria, autosomal recessive inheritance. Now in this disease, one atom of molecular oxygen is incorporated at the para position of phenylalanine and it is converted into para-hydroxyphenylalanine, while another atom of oxygen is reduced to form water molecule. Reduced to form water molecule. This reaction is tetrahydrobiopterin dependent. This is tetrahydrobiopterin, which is a coenzyme required for this reaction. The other enzymes which require tetrahydrobiopterin are, replace this phenylalanine with tyrosine and tryptophan. So tyrosine hydroxylase, the tryptophan hydroxylase and nitric oxide synthase. These are the 4 reactions which require tetrahydrobiopterin as the coenzyme. In this reaction, this tetrahydrobiopterin is converted into dihydrobiopterin and again regenerated with the help of NADPH dependent dihydrobiopterin reductase. It is again regenerated with the help of dihydrobiopterin reductase, which requires NADPH. NADPH. So this is important reaction in which phenylalanine is converted into tyrosine and tyrosine is metabolized into glucose, fat. It will give melanin, it will give epinephrine, norepinephrine, it will give dopamine and it will give thyroid hormones. Now phenylalanine hydroxylase is the important enzyme which catalyzes the conversion of phenylalanine to tyrosine. And whenever there is blocked in this reaction, when there is blocked in this reaction, it causes the disease phenylketonuria, that is known as classical phenylketonuria. Classical phenylketonuria. There are 5 types of phenylketonuria. This is type 1, that is known as classical phenylketonuria. Type 2 and 3, these are because of dihydrobiopterin reductase deficiency, and type 4 and 5, they are because of defect in dihydrobiopterin synthesis. Defect in dihydrobiopterin synthesis. So we'll discuss the classical phenylketonuria. Now what are the symptoms in classical phenylketonuria? Now see the symptoms here. So there is CNS involvement, central nervous system involvement is there in the form of seizures, convulsions, convulsion, mental retardation. These are the symptoms. Now why there is CNS manifestations in the phenylketonuria, that we will discuss. Then there is skin involvement, that is hypopigmented skin, hypopigmentation of skin, hair and eyes. That's why blue eyes, because decreased pigmentation of iris gives the blue appearance of eyes. अभी सभी को लगता है कि हमारी आंखें ब्लू होनी चाहिए, है ना, जैसे ऐश्वर्या राय की आंखें ब्लू है तो सबको लगता है कि हमारी आंखें भी ब्लू होनी चाहिए, लेकिन पीकेयू में साथ में मेंटल रिटार्डेशन भी आता है. Okay, the most common cause of blue eyes is inherited, but here in PKU the blue eyes is one of the manifestation because decreased pigmentation, decreased melanin synthesis and decreased pigmentation of iris, that causes the blue eyes, that causes the fair hair and the hypopigmented patches all over the skin. So CNS manifestation in terms of mental retardation, hypopigmented patches all over the body, mousy odor of urine. Mousy odor of urine. This is characteristic finding in phenylketonuria. Characteristic finding in phenylketonuria. So symptoms are delayed milestones, failure to thrive, mental retardation, seizures, convulsion, hypopigmented patches on the skin, the fair hair, and the blue eyes and mousy odor of urine. So why these manifestations are there in PKU? The reason is, see, there is blocked in this reaction. Which reaction is blocked? This phenylalanine conversion into tyrosine is blocked. So because of blocked reaction, phenylalanine is diverted for other byproducts. Which byproducts? So phenylalanine, it is transaminated. This phenylalanine, it is transaminated into phenylpyruvate. Phenylpyruvate, and this is keto acid. Phenylpyruvate, phenylacetate. These are the keto acids. Phenylacetate. So because of this phenylpyruvate, which is keto acid, and it is excreted in the urine, the name is given phenylketonuria. Phenylketonuria, because of excretion of phenylpyruvate keto acid in the urine. On the decarboxylation, this phenylpyruvate is converted into phenylacetate and phenylactate. Phenylactate. The characteristic mousy odor of urine in phenylketonuria is because of excretion of this phenylacetate. It is because of excretion of phenylacetate and other byproducts. Be diplomatic here, because in some books the phenylactate is given, but answer is phenylacetate. The standard books, TITS textbook, in the TITS biochemistry, it is phenylacetate which is given. So phenylacetate excretion in the urine and the other byproduct. So if there is question in the viva, why there is mousy odor of urine in phenylketonuria, go with phenylacetate and other byproducts. Just mention other byproduct. So phenylacetate and phenylacetylglutamine. So because of deficiency of phenylalanine hydroxylase, phenylalanine is diverted for the phenylpyruvate, which is keto acid excreted in the urine, hence the name phenylketonuria. Phenylpyruvate is converted into phenylacetate by the decarboxylation, and mousy odor of urine is because of excretion of phenylacetate. Mousy odor of urine is because of excretion of phenylacetate and other byproducts. Okay, so this is reason for the mousy odor of urine. Now, what is the reason for the CNS manifestations? Why there is CNS manifestation? This is because of increased phenylalanine level. This increased phenylalanine level, it competes with the other amino acids. So increased phenylalanine level, and there is no tyrosine. There is no tyrosine. So because of this, the neurotransmitter synthesis decreases. The neurotransmitter, कौन से neurotransmitters? The neurotransmitters, that is dopamine, norepinephrine, epinephrine means noradrenaline, and epinephrine. These are the catecholamines which are produced from the tyrosine. As there is no tyrosine, there is decreased synthesis of dopamine, norepinephrine and epinephrine. These neurotransmitters decrease levels of these neurotransmitters. Also, this increased phenylalanine level, it competes with the other aromatic amino acids, competes with tryptophan, which is bulky amino acid. Tryptophan for the transport competes with the tryptophan, and it decreases the production of serotonin. So this is reason why there is mental retardation, why there is CNS manifestations in the phenylketonuria, because of decreased synthesis of neurotransmitters, dopamine, norepinephrine, epinephrine, decreased synthesis of serotonin because of increased phenylalanine level, competes with the tryptophan, because aromatic amino acids, they are transported with the help of same transporter for the aromatic or neutral amino acid. So it decreases the transport of tryptophan and decreases the serotonin production. Also it affects, this is the first reason, this is second, and third, it affects the myelination of nerve fibers, affects myelination of nerve fibers. So because of these reasons, there is CNS symptoms in the phenylketonuria. It is clear now why there is mousy odor of urine, because of excretion of phenylacetate and other byproducts in the urine. Then why there is CNS manifestations, why there is mental retardation? This is because of decreased neurotransmitters, dopamine, norepinephrine, epinephrine, decreased synthesis of serotonin, because there is defect in the transport of tryptophan, because tryptophan gives the serotonin, okay, and there is defect in the myelination of nerve fibers, and because of this reason there is CNS manifestation. Now why there is hypopigmented patches? The hypopigmented patches because the tyrosine gives tyrosine is converted into melanin through various steps. Tyrosine is converted into melanin and tyrosinase. So tyrosine will give you dopa, dopa will give you dopaquinone, and through various steps tyrosine will give you melanin. So melanin synthesis in the melanocyte, it is with the help of important enzyme that is known as tyrosinase. So tyrosinase is inhibited by the increased phenylalanine level. Increased phenylalanine inhibit the tyrosinase and decreases the synthesis of melanin. So that's why there is hypopigmented patches. Hypopigmentation. That's why there is fair hair, fair hairs and blue eyes. Blue eyes. Okay. So hypopigmentation, fair hair and blue eyes because of inhibition of tyrosinase activity. So this is why, because of phenylacetate there is mousy odor, CNS manifestations because of decreased synthesis of neurotransmitters, decreased synthesis of serotonin and defect in the myelination process. The hypopigmented patches is because of decreased melanin synthesis, because increased phenylalanine level inhibit the enzyme tyrosinase. So blue eyes is one of the manifestation in phenylketonuria. Remember, the blue eyes, the most common cause is क्या बताया मैंने, inherited, the most common. But phenylketonuria also gives the blue eyes, albinism also gives the blue eyes because of decreased pigmentation of iris. Because decreased pigmentation of iris. See, these two mentally retarded brothers affected with untreated phenylketonuria. If you treat the phenylketonuria at the early age, the mental retardation will be less severe. It will be less severe. If the age advances, the mental retardation is much more severe. Okay, so two brothers affected with phenylketonuria, there is mental retardation. See the fair hairs. Okay. Now the laboratory diagnosis of phenylketonuria, it is done with the screening test. Now developed countries, it is replaced by the confirmatory test, but screening tests are there. One is Guthrie test, which is screening test for the phenylketonuria. Guthrie test, it is bacterial inhibition assay. Bacterial inhibition assay of Bacillus subtilis. Of Bacillus subtilis. तो इसमें क्या करते हैं, गुथरी टेस्ट में, ये स्क्रीनिंग टेस्ट है, ये कंफर्मेटरी टेस्ट नहीं है. और यूरिन पे दो टेस्ट, यूरिन पे एक टेस्ट है, उसको बोलते हैं फेरिक क्लोराइड टेस्ट. सो इन फेरिक क्लोराइड टेस्ट यू विल गेट ऑलिव ग्रीन कलर बिकॉज ऑफ फेनिल पायरुवेट इन द यूरिन, because of phenyl pyruvate in the urine. Now hill prick sample is taken. Hill prick का सैंपल लेते न्यूबॉर्न में, हिल प्रिक का सैंपल लेते, क्योंकि उस इनकी बच्चों की न्यूबॉर्न की उंगलियां कितनी छोटी रहती ना, तो हिल प्रिक सैंपल लेते क्योंकि ज़्यादा ब्लड लगता है ना, फिल्टर पेपर को सोक करने के लिए ज़्यादा ब्लड लगता है, तो हिल प्रिक सैंपल लेते न्यूबॉर्न में. नाउ सी, गुथरी टेस्ट इज ए बैक्टीरियल इनिबिशन एसे ऑफ बैसिलस सबटिलिस. इसमें क्या करते हैं, एक अगार प्लेट रहती है, दिस इज अगार प्लेट, दिस कंप्लीट इज द अगार प्लेट. इसमें एक इनिबिटर रहता जो बैसिलस सबटिलिस की ग्रोथ को ग्रो नहीं होने देता, एक इनिबिटर रहता इसमें डाला हुआ, वो ग्रो नहीं होने देता बैसिलस सबटिलिस। तो बैसिलस सबटिलिस कैसे ग्रो होता है? बाय यूजिंग द फेनिलैलेनिन इन द ब्लड। दीज आर द ड्राइड ब्लड ब्लड डिस्क, मतलब फिल्टर पेपर डिस्क, फिल्टर पेपर पे ब्लड सोक करते और उसको डिस्क शेप में कट करती उसके, या उसके डिस्क बनाते और यहाँ पे इस पे रख देते अगार प्लेट पे। तो जो जिसका डायमीटर, देखो इसका डायमीटर, ये कॉलोनी है, बैक्टीरिया की कॉलोनी ग्रो हुई है, तो जहां जहां डायमीटर ज्यादा है वहां पे फेनिलैलेनिन लेवल ज्यादा है। So level of phenylalanine corresponds with the diameter of the colony. So bacteria Bacillus subtilis will grow by using the phenylalanine which is present in the blood. So this is Guthrie test which is done for the screening of patient with phenylketonuria. It indicates phenylalanine level in the blood. Okay. So nowadays this is Guthrie test which is screening test. For the screening, Guthrie test is one, which is bacterial inhibition assay, and ferric chloride test. Ferric chloride test. Confirmation is by diagnosis is by mass spectrometry. Spectrometry. Spectrometry, mass spectrometry, specifically the tandem mass spectrometry. It is used for the detection of amino acid, inborn errors of amino acid metabolism. Tandem mass spectrometry, also gas chromatography and mass spectrometry combination, they are used by various laboratories, gas chromatography and mass spectrometry, for the analysis of amino acid or for the analysis of the compounds which are excreted in the urine. Also the phenylalanine level in the blood, phenylalanine in blood. Normally it is less than 20, but in PKU patient it is more than 20 milligram per deciliter. So phenylalanine level in blood, also phenylalanine hydroxylase activity is measured. Phenylalanine hydroxylase activity is measured. So these are the different tests which are done for the diagnosis of, lab diagnosis of PKU, phenylketonuria. Lab diagnosis of phenylketonuria. Now just wait. The treatment, what treatment should be given to this patient? So treatment is restrict the phenylalanine, low phenylalanine in diet. The food which contain phenylalanine should be restricted, the meat should be restricted. Then the tyrosine becomes essential and tyrosine should be supplied in the diet. Tyrosine should be supplied in the diet. Okay. The food which contain phenylalanine, for example aspartame is the artificial sweetener which contain phenylalanine. This should not be used in patient with phenylketonuria. The non-vegetarian food, that should be avoided because it contain high phenylalanine level. There are commercial preparations which are available and these are free from the phenylalanine which can be given to the patient with phenylketonuria. Now what is take home message here? What is phenylketonuria? It is inborn error of metabolism. Incidence is 1 in 20,000. The symptoms are CNS manifestations, hypopigmentation, blue eyes, fair hair, and delayed milestone, failure to thrive, excessive cry. These are the symptoms related with the phenylketonuria, and the characteristic feature is mousy odor of urine. Which enzyme is deficient? Phenylalanine hydroxylase is deficient. How many types are there? 5 types. The type 1 is known as classical phenylketonuria. What is the confirmatory test for the diagnosis? It is tandem mass spectrometry or gas chromatography and mass spectrometry combination. The mass spectrometer is it will detect the analyte on the basis of mass to charge ratio. And what is treatment? The low phenylalanine in the diet is the treatment. Now see the questions. See questions. Here, what is your probable diagnosis? Phenylketonuria. Which enzyme is defective? Phenylalanine hydroxylase. What is a cause for mousy odor of urine? It is phenylacetate excretion in urine and other byproducts also. Why hypopigmentation is there? because of decreased melanin synthesis because of inhibition of tyrosinase activity. Why CNS manifestations are there? Because of decreased synthesis of neurotransmitter, decreased serotonin synthesis, and defect in the myelination process. Mention the laboratory test, the screening test, that is Guthrie test, ferrichloride test. Confirmatory test is tandem mass spectrometry and gas chromatography mass spectrometry combination. Then what is treatment? Low phenylalanine diet, and as phenylalanine is low in uh, restricted, tyrosine should be given, because tyrosine now becomes essential because it is not produced in our body in patient with phenylalanine hydroxylase deficiency. So this is all about the phenyl ketone urea. Thank you all of you.